As the battle against novel coronavirus continues, the Asian Infrastructure Investment Bank, the AIIB, said it will support China with loans to meet the government's immediate and longer-term public health infrastructure needs. How important is public health infrastructure in tackling epidemics and other public health emergencies? What will this mean for the advancement of disease control? And how can public health infrastructure be strengthened, especially in rural areas? To discuss these issues and more, I'm happy to be joined by Mr. Jin Liqun, President of the Asian Infrastructure Investment Bank. That's our topic. This is Dialogue. I'm Yang Rui. Mr. Jin, the AIIB decided to invest in emergency public health infrastructure in China. Was it easy for example, the board to reach an agreement? How was it like to reach a consensus about investing in public health infrastructure?
As you may find from our announcement, which was issued Sunday night, we think we are in duty bound to provide support to the Chinese government and the people. And I said this has nothing to do with the financial strength of any member country. I think it's a matter of how we can cooperate with the Chinese government to deal with emergency public health challenge. And I do believe, not just because we stay in China, we are more careful, more concerned of the Chinese people's safety. We believe if we do a good job in China helping Chinese government people to address the emergency public health issues, we can also gain a lot of experience in helping the other countries, neighboring countries, for instance. I think this is very much important. You see, we are working with the Chinese Ministry of Finance in the course of designing an emergency loan to China. This loan will cover basically two parts. One is to deal with emergency need. For instance, I know Hubei, Henan, and some other provinces are in dire need of the medical masks, protective clothing, and any other kind of apparatus. So we are actually trying to purchase medical apparatus, equipment from abroad with a donation of the staff, matched by the bank's contribution. We are working on this. But I'm also concerned about the sanitation issues, disposal of this medical waste. This is a huge, huge issue. It's not handled well. It would lead to major environmental disaster. So in our preparation of the project, we definitely have to look at the emergency part. But on the other hand, we have to deal with the medium-term to long-term solutions. How we could prevent, and control the spread of this kind of viruses. Novel coronavirus is something which is different from SARS because the virus and bacteria are having this gene mutation, right? So we have to be prepared for anything of that kind in the future. That is why our project will cover two parts, for emergency and for long-term prevention and control.
Understood.
This is very much important.
Yeah, easier to understand emergency measures that have been rolled out on different levels in the host country. Yeah. Now, Mr. Jin, is the decision purely out of public welfare considerations? I'm talking about the sense of a corporate social responsibility, or is there also likely to be considerable market return based on commercial concerns, or is it more about the social responsibility for AIIB?
You see, we as a multilateral development bank we are mandated to provide support to our members. By the Articles of Agreement of this bank, we can provide financial support to any member country, regardless of their economic status. China is the biggest shareholder of this bank, accounting for 30% of its equity. So China has always maintained the point that China wants to leave the money to other developing member countries. China will never ever to create this bank and give the money to the Chinese. So this is not the bank's purpose of creating this bank. On the other hand, if China is in need of some kind of support, we in the bank should do it, not just because of the need of China from us. I know the Chinese government and the strong leadership of the Chinese government and the people are working very hard to control this virus. They can do it without us, no question about that. On the other hand, I think we are in duty bound to do whatever we can to be of some help to the Chinese government. As I said, the economic size or development stage of an economy has nothing to do with its ability to deal with emergency. If you look at 2003, when SARS hit China, China was able to eventually control SARS. Now, 17, 18 years later, the Chinese economy is twice as big as it was in 2003. But still, you'll find the government, particularly local government, find it very hard to deal with the challenge of this kind of outbreak of virus. So my idea is that the economic size of a country does not guarantee the ability of an economy to deal with emergencies. There are definitely vulnerabilities and blind spots of an economy. So we work with China.
Mr. Jin, we are very
to deal with
appreciative of your positive tones and upbeat message you deliver on behalf of AIIB about China's economic resilience. Yeah. But let's look at some of the problems. Now, since 1978, when China had just started its opening up and reform itself, the size of the Chinese economy has expanded by a bit over 34 times. Now, what has embarrassed us is that at the same time, our investment in the public health only increased by a little bit more than 3 times. That's a huge gap. So looking at the input into public health infrastructure, for example, over the past 12 months, is only 1.7% of the GDP in 2018, not 2019. Do you think it's enough? And how should the market respond to that?
You see, I follow the Chinese economy very closely. And in the designing of this bank, we look at the experience of China, other Asian countries, and developing member countries in Africa, in Latin America, Central Asia, and all of the world. So we believe, actually, when we design this project, it is not enough for us just to put money in the physical infrastructure. It's not just enough to increase the capacity of churning out manufactured goods from the assembly line. It's not enough. That's why if you look at the articles of agreement of this bank, we are committed to promote the economic or broad-based economic and social development through investment in infrastructure and other productive sectors. Why we want to include other productive sectors? Because at that time, we believed it would not be enough for us to just put money in physical infrastructure to build roads, railways, airports, seaports. It's not enough. You have to take care of social infrastructure. You have to take care of non-physical infrastructure, such as education and health. When I refer to education, I don't mean the traditional kind of education, but education which would be good for the next generation to fit themselves into the digital AI age. And also, with the aging of population in China and in a number of developing countries, we should be prepared for the urgent need of healthcare. So this was already included in our Articles of Agreement. Now, only 4 years into operation, we're all of a sudden faced with the urgent need to deal with healthcare. Healthcare is a public good. I don't think, for instance, if healthcare is good in China, it's good only for China. I don't think so. Virus or other kind of epidemic knows no national boundaries. If we don't control it, it definitely would affect the neighboring countries. That's why I think this is actually a very good opportunity for our bank to move into the non-physical infrastructure area and to work with the Chinese government to gain some experience. And we can also help other developing countries if something of this kind happens.
Now, very quickly, Mr. Jim, I'd like to have a sense about how to compare China's per capita health expenditure with other emerging markets, such as developing countries and BRICS economies. Do you think we have something, especially something to be proud of, or is this on an equal footing, basically? Because you look at dying to survive, 我不是药神 in Chinese, we take a very interesting look at the medical and pharmaceutical supplies in our neighboring country of India, and that has somehow, to be honest, that has put to China to shame. Now, by asking this question, can you quickly draw a comparison between India and China, and between China and other emerging markets in terms of a per capita investment in the improvement of a public health infrastructure?
I think there are two issues we need to look into. First of all, definitely increase the GDP allocations or national income allocations for healthcare is important. And I think Chinese government has always trying to raise the allocations of resources for healthcare all these years. It's not enough because, to a great extent, because of quick, very fast aging population who need more healthcare. Secondly, and I would like to, I think, alert you to the risk of very simplistic comparison between China, India, between China and other countries, or between any two countries in the world by the figure, because different countries have different systems. But of course, the pace of the need for healthcare and medical service has not been able to catch up with the public need. There's one thing, let me tell you this, I don't know whether you would agree with me. In the Chinese medical service to the people, we seem to have not put sufficient attention to the primary healthcare. And we have lots of the hospitals who have very good equipment. But how about community hospitals so that people would be treated well in these community hospitals without all moving to Beijing, to Shanghai, to be putting such kind of pressure on the top tier hospitals. And also, you see, when we Chinese catch some cold, we all go to the hospital. In the Western countries, they don't do it. They go to the drugstore. They get some drugs, non-prescription drugs. That's it. Why do you all rush to hospitals and mingling with all these patients? This will increase the risks of it.
It is a very heavy issue. Obviously, a very important task for the State Council and the Chinese authorities to address in the coming decades, when we have developed so fast over the past 4 decades, since the late 1970s. Thank you very much, Mr. Jin. I'll get back to you very quickly, but you are watching Dialogue with Mr. Jin Liqun, president of the AIIB, and he used to be working for the Minister of Finance as a vice minister and also vice governor of AIIB based in Manila. Thank you for being with us. We'll be right back after this. Stay with us. Welcome back. I'm talking to Mr. Jin Liqun, President of the AIIB, with a focus particularly on why this multilateral financial body has decided to make an investment in the improvement of a public health infrastructure in China to help alleviate public concerns about national security in this particular area. Welcome back, Mr. Jin. Now let me raise a follow-up question concerning the alleged uneven distribution of medical services and medical supplies resources throughout this biggest developing country of China. Now, how can China make a full use of its advantages in artificial intelligence and big data to prevent and control epidemic and other public health emergencies? Because obviously, we have a sizable population of up to 1.4 billion. That's a lot. That's a lot. Obviously, relying on traditional use of medical resources would be impossible, or a mission impossible. So I'd like to have your thoughts about the China solution.
I think the government has taken quick actions to control and contain the virus spread. If you look at a whole country, you'll find the virus, and also the people who are affected still concentrate in Hubei, Wuhan, and some other areas, and probably the neighboring provinces, some of the neighboring provinces which are hit more seriously. But overall, I would say the situation is being kept under control. The data and the very quick statistics which we have every day indicates that the measures the government has taken seems to be effective. Now, I think what is most important is for us to know that any virus, such as this, novel coronavirus, is really a big issue, and the early warning system is very much important. So in the future, I think we need to improve the early warning system.
Particularly, I'm focusing on the availability of medical resources in the underdeveloped rural areas. Do you think the term big data will help solve and fix the problem in China?
Of course, it would be of help. But you see, so far as this epidemic is concerned, it has hit Wuhan and some, cities in Hubei province. It has not reached far out to vast rural areas. This is partly because in the rural areas, the population is more or less scattered, and it's not easy for the virus to be affecting the people. But data, I think data is important. We need to use the data to do prevention and to help people to understand where.
Particularly when more and more young villagers can have easy access to the internet, and they are actually smartphone users. So the use of big data may hopefully help fix the problem. Now, let me ask you one more question concerning multilateral financial institutions. Apart from AIIB, other multilateral institutions may have also offered to support China, for example, ADB and the World Bank. Let me ask you, Mr. Jin, what are the selection criteria for AIIB which are different from ADB and the World Bank?
So far as our mandate is concerned, all of the multilateral development banks should provide timely support to their member countries in times of emergency. And I don't think there's any difference in this regard. The World Bank is more experienced in healthcare, education, with non-physical infrastructure. So if the World Bank would like to do something, I think it's more than welcome. ADB has been working consistently with China ever since the 1990s, and I think ADB also is equipped to provide support. We are new, and we have not done anything in terms of non-physical infrastructure. But that will not be a problem for us. First of all, we have already been discussing a joint concerted approach to work with the Chinese government and the people. This has already been discussed. On the other hand, because of different levels of capacity and their different focus, we are also prepared to do it individually if need be. What is important is to streamline the procedure, to take quick actions rather than being tied down in bureaucracy. That's why I have told our management and the professional staff to be as quick as possible. We should have streamlined procedure in approving this loan by the board.
For example, the Asian Development Bank has approved recently up to $2 million in new funding to support efforts to combat the spread of virus. And I believe AIIB, along with the World Bank, may have also made your efforts in the correct direction. How do you evaluate the impact of the epidemic on Chinese economy at a time when the U.S. and China are bilaterally engaged intensively in the phase 1 trade deal, and we have to take a look at the impact of our epidemic breakout upon the British economy following the Brexit? I'd like to have a quick idea about the broad picture concerning the impact itself on the world economy.
Well, I think you have a good point here. Given the size of Chinese economy, its close trade and investment relations with the United States, with the UK, with other European countries, and many Asian countries, definitely people will watch this situation very closely. I cannot rule out the possibility that the epidemic would take a toll of the Chinese economy. Probably China would have a little bit, percentage points in terms of the growth. But I do not think it will be a major, big impact on the Chinese economy. I don't want to specify how much this is going to happen to the Chinese. And if you look at the impact of SARS on the Chinese economy, it was very much limited. And looking at the current situation, because I watch the daily development of the control of the novel coronavirus, it seems that the government is capable of controlling this situation. And so I would say probably by the end of this month and no later than early next month, things would go back to normal. So in terms of the GDP, it's not going to be a big problem. And what is important, as you see, the Chinese economy is on the cusp of major structural change, and Chinese economy need to adapt to the changed situations of global economy, should adapt itself to the AI era, AICT kind of thing. So probably this is also time for the government and the major governmental institutions to sit down and to map out the development program. With regard to the impact on the rest of Asia or the rest of the economy, I think the impact will be still less because the United States now have reached an agreement, phase 1, and trade agreement, and I think it's moving forward. And I hope the Chinese government and the United States will continue to work out the remaining issues so that the U.S.-China trade and investment relations will go back to normal. This is very, very important. With regard to Brexit, as you see, the British government is trying to ease the possible impact of Brexit as much as possible. Likewise, the continental European countries also believe it's important to work out a solution with the UK. So far, you see, and it's not going to be something which we have not predicted. I would say things being worked out pretty well between European countries and the UK. So overall, I'm pretty optimistic. As long as we can control this situation as quickly as possible by the end of this month or early next month, it will not be a big problem.
Thank you very much, Mr. Jin, for briefing us on how you look at the world economy and the impact of the epidemic disease upon the rest of the world through, for example, a project by AIIB to invest in the improvement of public health infrastructure to combat the spread of the disease. I'm so glad to be with you at this difficult moment. Thank you, and until next time, goodbye.